Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about a systematic review of disease prevalence, health-related quality of life, and economic outcomes associated with Friedreich's Ataxia. It is important to understand the burden of FA, including its extent and the most salient elements. The objective of this study is therefore to systematically review the literature regarding the aspects of prevalence, health-related quality of life, HRQOL, and economic outcomes that are associated with FA, and to subsequently identify relevant knowledge gaps. 3 systematic literature reviews were conducted to assess publications regarding FA prevalence, HRQOL, and economic outcomes. Search strategies were implemented in Medline, Ovid, and M-based databases. Study selection and quality assessment were conducted using current best practices. For each review, study characteristics and findings were summarized. A total of 36 studies were included. Review of prevalence studies, N equals 22, indicated variation in the number of cases by region, and many regions not represented at all. Regarding HRQOL, N equals 12 studies, physical domains were consistently impacted, although findings regarding other domains and overall HRQOL were less clear. Cost studies, N equals 2, encompassed 4 regions and revealed that costs related to the provision of care, including non-medical direct costs and indirect costs, accounted for the majority of FA-related costs. Findings from this systematic review revealed several knowledge gaps that would preclude the conduct of a robust assessment of the benefits and outcomes associated with a disease-modifying FA therapy. Additional understanding regarding patient and caregiver HRQOL and costs is required. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about PTC 743. PTC 743/vatiquinone, previously AP 743, is a follow-on or sister compound to APA 0001, which aims to improve mitochondrial and cellular function by targeting 15-lipoxygenase, the key enzyme regulator of a pathway of inflammation, oxidative stress, and cell death, known as ferroptosis, which has been implicated in CNS disease, including models of Friedreich's ataxia. Vatiquinone has been granted orphan drug designation and fast track designation for FA by the U.S. Food and Drug Administration, FDA. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about elamipretide. Elamipretide is a peptide compound being developed by Stealth Therapeutics. It targets the inner mitochondrial membrane where it binds reversibly to cardiolipin. In preclinical or clinical studies, elamipretide increases mitochondrial respiration, improves electron transport chain function and ATP production, and reduces formation of pathogenic ROS levels. Functional benefit is achieved through improvement of ATP production and interruption and potential reversal of damaging oxidative stress. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about dimethyl fumarate. Dr. Gino Cortopassi at the University of California, Davis and other groups have observed that NRF2, nuclear factor, erythroid-derived 2, like 2, a protein that is critical in a pathway to protecting the cell from oxidative stress, is paradoxically decreased. Specifically, Dr. Cortopassi's group has shown that NRF2 protein is decreased in frataxin-deficient cells and FA mouse models. Through a drug discovery program that screened a library of clinically approved drugs, the group has identified several compounds that act as NRF2 activators and rescue biochemical and cellular deficits related to frataxin deficiency. Ixchel Pharma LLC has options on this intellectual property. One of the compounds identified through the screen was dimethyl fumarate, a drug that has been approved for treatment of multiple sclerosis and psoriasis. Dr. Cortopassi and colleagues have shown that dimethyl fumarate can induce mitochondrial biogenesis in multiple sclerosis patients, and that this is via activation of NRF2 pathway. Thus this group hypothesizes that other mitochondrial conditions, like FA, that have impairments of NRF2 activation and loss of mitochondria might benefit from treatment with dimethyl fumarate. This information was taken from FARA Australia with their permission. Their link is provided in description.